Hello, and welcome to Healthy Care. In today's video, we'll dive deep into understanding croup, a common illness that affects babies and young children. We will explore what croup is, what causes it, the symptoms, and the best ways to treat and manage this condition. If you're a parent or caregiver, knowing how to handle croup is essential, as it can cause breathing difficulties in children. By the end of this video, you'll have all the knowledge needed to care for your child if they develop croup, and when it's time to seek medical attention. What is croup? Croup is a viral illness that typically affects children under the age of 3. It causes irritation and swelling of the upper airways, making it difficult for the child to breathe. The area around and below the vocal cords becomes narrow, leading to that signature barking cough that sounds a lot like a seal. When your child has croup, you might also notice that their breathing is raspy or noisy, and their voice sounds hoarse. Crying often worsens the symptoms, as it can make their airways swell even more. Croup is most common in children under 3 years old because their windpipes are smaller, making it easier for swelling to block their breathing. Causes of croup. Croup is usually caused by a virus that infects the vocal cords, larynx, and windpipe, trachea. One of the most common causes is the parainfluenza virus, but other viruses, such as respiratory syncytial virus, RSV, and the flu, can also cause croup. The infection usually begins as a mild cold, but over the course of 3 to 5 days, the symptoms can worsen, leading to noisy breathing and that classic barking cough. There are also less common types of croup, such as spasmodic croup and bacterial croup. Spasmodic croup often happens suddenly, typically in the middle of the night. It's believed to be linked to allergies or acid reflux, which can cause sudden swelling of the throat. Risk factors. Croup is most likely to affect children between the ages of 3 months and 5 years. It's more common during the fall and winter months. Boys are slightly more likely to get croup than girls. Croup is also highly contagious. It spreads through respiratory droplets when an infected child coughs or sneezes. The virus can stay in the air and on surfaces, so it's important to maintain good hygiene to prevent its spread. A child is most contagious during the first 3 days of symptoms or until their fever subsides. Symptoms of croup. Croup often starts like a regular cold. Your child may have a runny nose, fever, and mild cough. However, as the illness progresses, the following symptoms can appear: a barking cough that sounds like a seal, raspy or noisy breathing, especially when crying, hoarseness in the voice, low fever. Symptoms of croup are usually worse at night, and your child may also experience redness around the eyes or swollen lymph nodes. When to seek medical attention. While most cases of croup are mild and can be treated at home, it's important to recognize the warning signs that require immediate medical care. Difficulty breathing. If your child is struggling to breathe or has rapid, shallow breaths, seek help immediately. Retractions. This is when the skin around their ribs pulls in tightly with each breath. Cyanosis. If the skin around their nose, mouth, or fingernails starts to turn blue, this could indicate low oxygen levels. If any of these symptoms occur, take your child to the emergency room right away. Serious cases of croup can lead to low oxygen levels, dehydration, and other complications that need medical intervention. Diagnosis. Doctors can often diagnose croup by simply listening to the child's cough and breathing sounds. In rare cases, they may order an X-ray to check for other possible issues. Your doctor may also ask about recent illnesses, and if necessary, perform a throat examination to rule out any other conditions. Treatment for croup. Most cases of croup can be managed at home. Here are a few tips to help your child recover. Stay calm. Try to soothe your child, as crying can make their symptoms worse. Keep them upright. Keeping your child upright can help them breathe easier. For children over the age of 1, you can prop up their head with pillows while they sleep. Plenty of fluids. Encourage your child to drink clear, warm fluids like apple juice or warm water. Fluids help keep the vocal cords moist and reduce irritation. Steam or cool mist. Using a humidifier in their room or having them breathe in steam from a hot shower can help soothe their airway. If your child has a fever, over-the-counter medications like acetaminophen can be used, but avoid giving them cough medicines, as they are not recommended for young children. Hospital treatments. For severe cases, hospitalization might be required. In the hospital, your child may receive treatments like steroids to reduce swelling in the airway, epinephrine mist to open up the airways quickly, for fluids for dehydration, oxygen therapy if their oxygen levels are low. In rare cases, a breathing tube might be needed to help them breathe until the swelling goes down. Preventing croup can be challenging because it's a viral illness similar to the common cold. However, you can reduce your child's risk by practicing good hygiene, wash hands frequently, clean toys and surfaces regularly, teach your child to cover their mouth when they cough or sneeze, keep your child home if they're sick to prevent spreading the virus to others. While there is no vaccine for croup itself, keeping your child's vaccinations up to date can protect them from other serious infections like diphtheria and Haemophilus influenza, which can lead to croup. Croup can be frightening, especially when it causes breathing difficulties. However, most cases are mild and can be treated at home with care and attention. Remember to stay calm, keep your child hydrated, and monitor their symptoms closely. If you're ever in doubt or your child's breathing becomes labored, don't hesitate to seek medical help. Thank you for watching Healthy Care. Don't forget to like, share, and subscribe for more helpful tips on keeping your family healthy. If you have any questions or experiences with croup, leave a comment below. We'd love to hear from you.